Thank you for joining us today for our Mosaic's Community Life in Canada podcast. My name is Jane Teasdale, one of the principal owners of Mosaic Home Care Services and Community Resource Centers. During our podcast sessions, I will be interviewing researchers, advocates, healthcare professionals, community organizations, family caregivers, personal support workers, volunteers, and those in the community. I will be featuring such themes as the importance of socialization in our communities, community mapping, connection, community assets, loneliness, integrated care, family caregiving stress, home care, long-term care, compassionate communities, and the person-centered care movement in which Mosaic feels very strongly about. Today, our very special guest is Mimi Lee from North York Senior Centre, in which I refer to as the Jewel of North York. I have also known Mimi through this centre for the last 20 years. Welcome, Mimi, and glad to have you join me on our very first podcast. I was wondering if you could explain to the listeners your role at North York Senior Centre. And also, I would ask you a little bit later about the background and the history about the North York Senior Centre. So please go ahead. Thank you.
Thank you, Jane, and thank you for inviting me. Yes, so my name is Mimi, and I'm the HR coordinator at North York Senior Centre. And yes, I've been around for over 20 years at North York Senior Centre. I first started as a recreationist. My background is in recreation with seniors, and have experience working with the day program and also with active seniors, and moved on to the administration where I am right now in with volunteer management and overseeing the volunteers and how they connect with our clients, and also with the administrative functions for HR. So that is where I am right now.
So you've had, I guess, a lot of responsibility in the different areas that you've worked. So I guess with your roles, it's easier for you to understand the whole center and how things work within North York Senior Centre. I did a little bit of research on North York Senior Centre to educate myself. And I learned actually that in 1974, it was developed by a group of seniors in the local community of North York. And so that intrigued me on how, a group of seniors got it together. And, now look at this place, North York Senior Centre, which is amazing. Can you explain a little bit about the historical data and information about North York Senior Centre? Thank you.
Mm-hmm. Yeah, so we've been around since 1974, where a group of seniors got together, wanted a place to meet and socialize and enjoy the recreational activities. They asked their mayor at the time, Mel Lastman, to provide them a building for that, and they were granted a storefront in Northtown Plaza. We became a United Way member agency in 1977. And then we opened our doors at 21 Hennon Avenue in 1987, which we also provided delivery of in-home respite care for community supports. In 1988, we opened up our 80 Shepherd Avenue West location, which provides community support services such as transportation and in-home services to clients in the community, and a day program. In 2009, we received funding through the Central Lynn to provide assisted living programs in 2 locations in North York, our Kempford and Beecroft Manors. And then we expanded in 2013 to provide another assisted living building where we would have in-home services at our Hesperus Fellowship Village in Vaughan. In the same year, we earned our 3-year accreditation status through CARF Canada. So we started with 1 building, and now we are an organization of 5 different buildings.
Well, that's pretty amazing, that it all started actually from volunteers in the community and older adults seeing that they needed a space within North York. And also, I must say that, North York Senior Center has played a special place in my heart because they've done a lot within North York, and their programs and services and connection to the community, has been going on for many years. Many of the, professionals that work at North York Senior Center, from the social workers to the volunteers to the people that answer the phones, are all amazing, and certainly focus on a person-centered care model. I would say anybody coming into the center is always feeling that they're welcomed. So that's amazing. Our conversations today will focus on social connections, importance of social spaces for the community, neighborhoods, and how organizations connect to homebound older adults or individuals to programs and services. Referring to the World Health Organization report on elder-friendly communities is one that recognizes great diversity amongst older persons, promotes inclusion, and contributions in all areas of community life, respects decisions and lifestyle choices, and anticipates and responds flexibly to aging-related needs and preferences. 27% of older Ontario respondents are not socially connected, and 17% reporting feeling isolated. Organizations, healthcare professionals, home care agencies, retirement homes, and long-term care need to encourage interaction with the community where possible, with interests, meaningful conversations, hobbies, and activities. In most cases, those with complex care and deficits are disconnected from the community. So how do community agencies and healthcare professionals keep individuals engaged? Mimi, what is North York Seniors Center view on the importance of social connections and really bringing the community together? Maybe if you can explain this. Thank you.
Mm-hmm. Yeah. Social connections, to us, it's really vital to seniors' well-being. We feel that when people are more connected to their community, they're more likely to be engaged and participate as members of the community. It's all really about, building those strong relationships, which is one of the important values that we have at North York Senior Center. It's a way to build, social networks, connecting with each other, building those relationships so that, we are reducing the social barriers and isolation that seniors may be going through. I believe communities bring like-minded people together with these similar values and interests that they may have, and that builds valuable and meaningful relationships and gives them the sense of belonging.
Yes, I agree.
Which is so important, yes.
I agree with all those points. And, to add to that, definitely, as you mentioned, the social relationships, the meaningful conversations that people have. And, certainly friendships are still important because sometimes that happens when there's a deficit or somebody is ill. Sometimes the friends, aren't calling or visiting. So I think it's important that people do try keep connected. One other point that I wanted you to highlight is how does North York Senior Center connect with homebound seniors and those that may have complex medical conditions?
Well, as we all know, since spring 2020 in the pandemic, North York Senior Center, just like everyone else, had to find innovative ways to assist and connect seniors to help them stay engaged and remain active. This is no different for seniors who are homebound or those with complex medical conditions. So we offer programs using technology. So virtually using through Zoom, we offer classes such as fitness classes, language conversation, special interest educational programs. And we know that seniors, not all of them have access and ability to use technology. So we also offer programs using the phone, and they can connect with other seniors using the phone program, what we call Seniors Without Walls. And it's a United Way initiative, and programs such as trivia, Name That Tune. And since then, we have been delivering over 1,000 activities online, whether it's through Zoom or through our social media platforms, and over 7,000 over the phone. So we've been quite busy, just as busy as we have been, but not having any in-person activities, but more so through phone or through online. We also have telephone reassurance and wellness calls or security check calls that seniors can participate in, as we know that we are reaching out to them through phones, and they appreciate those calls. And it could be where they have these mobility issues and accessibility issues that are not able to access programs, and we're there to give that friendly call to them and reach out to them.
Yes. No, thank you. All very important, in connection. And I guess, with COVID, organizations have had to take whatever they've done socially in person and move it online. And, I think the benefit of that, I mean, there's downsides, but the benefit of that is those individuals that couldn't get out to come to social programs, and if they have, technology in order to go online or a phone, they're still able to connect. So, and I noticed with Mosaic as well is, we're getting more people that are coming online from all over. So it's a benefit.
For sure.
And very, very important for organizations to implement those as well. And just if there is a new member to North York Senior Center, how do you make them feel welcome and connected? And how do you get them connected?
Well, we would connect with them and call them and find out a little bit more about them, assess their interests, to try and connect them to their programs of interest, making sure we're matching them or connecting them to the right staff who can support and guide them to what programs and services that are available. We see if they may need other community support services. They will go through our intake information line to find out other types of North York Senior Center services, such as in-home to provide them personal care in their homes or transportation for medical appointments. So we take on more of that person-centered care approach for our clients and tailoring our programs and services to meet their personal needs and preferences, to make them feel welcome and comfortable and enjoy what they're going to be participating in.
That's right. No, definitely. I mean, you know how strongly Mosaic feels about the person-centered care movement. And, certainly I think it is important, especially now, that I see is community agencies sort of working together within the community, because not one organization can provide everything. Mosaic Home Care has provided, information to our clients, on services that we don't provide that maybe North York Senior Center or some of the other organizations do. So it's lots of things are going on within the communities, and certainly our organizations are helping communities, and individuals. So, as you know, through the COVID-19 environment that we are in and continue to be in for I don't know how long, what type of volunteering services or are you using volunteers around this time, and how do you use them in this type of environment?
Yes. Yeah, so certainly in the past year, we have seen our in-person volunteer opportunities and activities suspended because of COVID, and many of our seniors are also volunteers. So even more so that a lot of our volunteer activity has been suspended to keep everybody safe. So we've pivoted to some of them to virtual or remote roles, or really modified or even creating new roles altogether. Our friendly visiting program, for example, where we have volunteers connect with seniors who tend to be a little bit more isolated, and they would, before COVID, they would make those friendly visits in their homes and interact with them socially. Now we have them calling our clients, or if possible, if there's an opportunity that they can connect virtually, whether they may have Skype or Zoom, and that way they can still have that face-to-face connection interaction with each other. We also have students who have been wonderful in putting together virtual programs for them, connecting them, and bringing fresh new ideas that we may not have offered in before. We also have connected volunteers to provide administrative support to staff and things like our caregiver support groups and education sessions. We have a volunteer who provides a bit of that technical support to our team and making sure that things run smoothly and that caregivers can fully benefit from the sessions. And if they have any questions on how to use the technology, we have a volunteer with their expertise and skills to provide that for them. And we've also continued to been very fortunate to have volunteers to provide those wellness calls, as I mentioned earlier, about connecting with those who would really appreciate those, just even a 5-minute call, just to give the senior a time to connect with somebody there.
Yes, most important, those, telephone check-in calls. I do know that you had a special program that you were talking about. We spoke about it last week, is the letter writing program. Can you talk a little bit about that?
Yeah, it is an intergenerational program where we've connected with a group of high school students who correspond with seniors through letter writing. They share about their hobbies, their likes, their dislikes, any thoughts that they may have about what they're going through and experiencing. And it's really given an opportunity for seniors to keep their minds off from being lonely and feeling the isolation because of the pandemic and the lockdown that they're in. And it's great to see the friendships that are forming between these two groups. The high school students who are learning things from the seniors and vice versa. The seniors are learning a lot from them and the type of music that they listen to, the hobbies that they have, and really great to see some of them who have very similar interests as well that we didn't know that they had. So it's a great connection. And really the impact that these letters have to cheer these seniors up and during these challenging times. And the seniors, the students also have commented on how they really enjoy reading and writing these letters to them, and they have a better sense and understanding and appreciation of the
Yes.
connection that they would have with seniors and the compassion that they will have with them as well. So it's just a wonderful program.
No, it is amazing. And they're learning, the older adults are learning about the younger generation. And then obviously the younger generation are learning about things about the older generation. So lovely, sharing. I think going forward, post-COVID, whenever that is going to be, it's been a long haul. How will North York Senior Centre position themselves post-COVID? Are there any things that you're looking at, or hybrid model? Sort of, if you can discuss that a little bit more.
Yeah, I think that North York Senior Center will take on more of a hybrid model, seeing that how successful these virtual programs have been going through. But of course, in-person social interaction, you can't replace that,
No.
really, having that contact. So I think there will be a hybrid model mixing up with the virtual and the in-person programs, as long as they're facilitated safely. I do see that, in the future, even though post-COVID, it will change the look of how we are delivering these programs. We may have to limit the number of participants to make sure people are able to physically distance from each other, whether, maybe with all the vaccination going on, maybe may not have to wear the mask, or we may have to, depending on the situation. So I think that it will change a little bit. It will be modified, but I think it will be a combination of the two, which is really important. And really seeing that technology plays an important role now too, in understanding the technology barriers that seniors may face now as well. So there are some really exciting programs that we will be offering that falls along that as well to keep seniors connected.
Yes. No, it's very important. And, again, that's what Mosaic is looking at. most likely a hybrid model as well. And again, what is that going to look like when you start opening up your senior centers or resource centers or activities in the churches? You're having to still follow the guidelines and, proper social distancing, as you mentioned. I guess checks, if individuals are coming into the building or if they're to wear their mask at that time or not. So all things we have to consider. And it's all very new, certainly moving forward, and a lot of thought, I think, needs to go into that. And I guess, with our, letting our listeners know, Mimi, of any wonderful, again, any highlighted programs you want to mention that are standing out, that are coming shortly or in June, because I know June is Seniors Month as well. Is there anything that stands out?
Yeah, I mentioned about technology, and we are starting up a computer lending program where seniors can borrow a tablet to access programs online. We know it's a big issue where seniors may not have the ability to connect because they don't have the equipment or the knowledge to know how to use it. So for this program, we're also providing training for seniors. There's IT support and expertise so they can learn how to use the device, and so that they can keep connected. And it's a free program. They don't have to pay. There is some conditions that they do need to follow. It's open to the clients, caregivers, and volunteers of North York Senior Center. It's a free program for them to take part in. There's also another program that we receive funding that we receive a grant to start a satellite program. It's called Mobile Active Living, and it's where we will travel in the community to either seniors' residential buildings or open spaces, areas where we can implement programs to them and bring it to them as opposed to they come to us. And it could be, in the park, putting together a mindfulness session. We're driving our vehicle and we will host a session out there so everyone can join, and so that it's for seniors who may be experiencing some level of isolation. But it's really seeing how we can make programs and services accessible for seniors, ensuring that there are social interaction and connections, yet also keeping them safe and following the COVID protocols, and really also fostering, our environment of fun and positivity.
Yes. No, that's amazing. And, Mosaic has worked on community mapping and using community assets. And that's a brilliant idea of, your transportation going to the areas or going to the parks where you're getting people to come out in a safe environment. So that's brilliant. And, I think the most important thing is how would people contact you for services or your social programs online is most important. So maybe you can provide that to us.
Yes, for sure. Yes, our website is www.nyseniors.org. Or you can reach us by phone, 416-733-4111. So either phone or internet, you can see a bulletin or e-bulletin, which would give you a guide of all the different programs and services that we offer, more so for our Active Living Center, but does give information of all the other services that we're providing right now.
Excellent. And lastly, Mimi, can you provide us with a takeaway message for our listeners? Anything you wanted to highlight?
Yeah. Well, we talked a lot about the benefits of social connections for sure, and the theme of that and how important it is. So with social connections, it's good for everyone's overall health and well-being. So I guess the saying I would say is, stay and be connected. It's good for you.
Yes. Mimi, it was a pleasure to have you today on our first podcast. We really appreciate you joining us and North York Senior Center for being our guest today. You can certainly find our links. We will put that up on Facebook and Twitter. Our links can be found on iTunes and Spotify. Just a couple of words from Mosaic. Stay home, stay safe, and get vaccinated. And thank you for joining us today.
Thank you, Jane. Always a pleasure.
Thank you.